The US healthcare system is full of made up prices and is intentionally complicated to keep you poor, broke, and unaware of what's going on. It's Justin from Health Made Clear. Today's video, we're going to go a little bit different direction, and we're going to talk about a personal experience that I had with healthcare. I'm sure that you guys have a similar healthcare experience, but I want to talk about what's actually going on. So, story goes, I needed to get a lab test, and I got it from my doctor, but the specific test that I needed, my doctor's office could not run the test. It's like, hey, why don't you go to Intermountain Healthcare, which is the big healthcare insurer out here in Utah, and see what they can do. Quickly to point out, this is not just an Intermountain Healthcare issue. This is a healthcare issue across the entire United States. Intermountain Healthcare is just who my experience was with. I'm sure it's no different with any other healthcare provider in any state in the country. This, I'm very sure, is ubiquitous across the entire healthcare sector. So what happened? So first thing I did is I was trying to be a responsible consumer, and I called LabCorp and Quest Diagnostics, and I got their price for this test. And they said one of them was $220, one was like $225. So pretty close in price. And I called a third because I just thought it would be a good idea. And Intermountain gave me a healthcare price for $171 and some change. I'm like, wow, that's $50 less. That's awesome. I will go do that. Mind you, this was a single lab test with no doctor looking at it, no collection fee, nothing like that. I had to go, give the sample, and then come back. That was it. It's basically like calling the grocery store and asking for the price of Land O'Lakes olive oil butter. I asked essentially I'm asking for a specific product and the price of that specific product from the store. It cannot get more simple than that, and they should be able to give me an accurate price. So I go, give the sample, come back, whatever, think I'm good. And I want to point out that the price that I called and got was what they called an estimate, which gives them some wiggle room for some changes in price. Okay. So then a couple days later, get the test, all that stuff. The results are fine, whatever. I get the bill in the mail. And the bill, I've already paid the $171 and some change because I prepaid up there up front. And I get this bill for $80 in addition to the $171, which puts the price of the test at $250, which is $30 more than I should have paid at the other place. And what's frustrating is when I spoke to the person on the phone, I told him, hey, I am shopping for good prices. So it's not like he was unaware that I had already made calls and I'm looking for a good price. And so he gave me the $171. And I think that's a good deal. And I go do my thing. Feels like a bait and switch, but we'll get there. So then I get this $81 bill and I'm thinking to myself, this must be a mistake. I called and I got a quote. So I call them and they're like, oh, no, that wasn't a mistake. That was our estimate. Estimates are not always guaranteed to be accurate. And then I asked her, well, this was a single line item lab test. How can you not give me an accurate price on a single item that I'm asking for? I know that it's a single CPT code, which is what they used to bill everything. And there's no reason that you guys couldn't have given me an accurate quote. And then she proceeds to tell me that the real price of this test normally is $340. And that they gave me a cash price discount because I paid cash on the $340 down to the $250. So they gave me a $90 discount, but I still have to pay the extra $81 because that's the cash price. And that got me thinking, how on earth is this $340 number and this $171 and this $250 related? And that's when we got into the make-believe, made-up, imaginary healthcare system and its world of pricing. So the number that I was initially given was the estimate. We know what an estimate is. It is their, quote, best guess of a price. What's frustrating is it appears that the guessers at Intermountain Healthcare are either liars and they have no intention of telling you the truth, or they don't actually have a price and it is in fact made up on the spot, which is what I think it happens. Because it's not like this was a complex surgery where things can go wrong or certain parts don't fit. You know, you've taken your car to a mechanic and they're like, yeah, it'll be this much to replace the timing belt, and then they call you, hey, it turns out that your water pump is really bad too, and we've got to put one of those on there. It'll be an extra amount of money. Nothing like that. This is simply lab test, like, give me the price for that Land O'Lakes olive oil and sea salt butter. That's it. So why do they have that really high price? That really high price is what is called the charge price. And it goes back to this thing called the charge master. So the reason that we have the charge master is because, remember, the hospital's job isn't to get money out of you, because you, as the patient and essentially the product in this case, aren't the one paying them. It's the insurance company. You are also the insurance company's product. They essentially pimp you out for healthcare, and then they pay money for services, but they get this big discount, and then you're paying this big premium the whole time, and deductible and all of that BS, which we're not covering in this video. So the insurance company wants to feel like they're getting a good discount, because they want to be able to take that discount and they want to be able to put it on their advertising and say, hey, if you go with X insurance company, we'll give you a fat discount. So they may say, hey, we're going to charge $340 for this test that we quoted at $171, but really is $250. But we'll say we charge $340, then you can give us roughly a 25% discount, and that's saving you a lot of money. And the insurance company is like, cool, we're saving 25%. And remember, the hospital wants to make a bunch of money too. And so if they say this thing is $100 and they give a 5% discount, well, they're not going to make as much money on the $95 bill, and the insurance company isn't going to feel like they got a big discount with a 5% discount. Instead, it makes sense for both of them to raise the price super high, because then the hospital will make more money, because 50% off of $300 is more money than 50% off of $150 or $200. And the insurance company gets a big fat discount on their price, which they can then post and show to you, the consumer. And so the reason that they do that is because for the insurance company, it gives them the illusion of a deal, which they can then pass that illusion of a deal onto you. And it helps the hospital and the healthcare company maximizing payout, so they make a bunch of money. Now, here's what's really annoying. So with that charge master, they also get to do something called charity reporting. So if you are a not-for-profit, you have to give away X amount of dollars for insurance, or for the government, essentially. It's part of being a not-for-profit. I don't know what the number is. I have no idea what it is. I'm sure it varies in the size of the organization. But when you do it, you get to count what you're giving away at the list price, essentially. So if you're giving away a whole bunch of these lab tests, you get to write that they were $340, even though it probably costs you significantly less, and you sell that thing less to insurance companies. So what it does is it means they have to give away less of this stuff to meet their taxable deductions that they are required to meet for the government. Again, inflating it only benefits them. One thing that's also very irritating about this whole thing is the full absurdity of the charge master rate is what's billed to oftentimes the most financially vulnerable. So the uninsured, or people without insurance, or those who received services that fell out of their insurance coverage, like maybe an out-of-network cost, were often billed the full non-negotiated charge master price, which, as we know, one of the quickest ways to get into debt and declare bankruptcy in the US is to just have a high astronomical medical bill because something out of your control happened. The other thing is called balance bidding. So before federal laws like the No Surprise Act, which in my instance, this was a surprise anyway. Before the No Surprise Act came, patients who received care from an out-of-network provider at an in-network facility, so it used to be you'd talk to your surgeon because you can shop for your surgeon, but you have no control over who your anesthesiologist is. So what would happen is you'll get your knee surgery, whatever the heck it is, and then you'd be assigned an anesthesiologist, and then that specific anesthesiologist didn't take your insurance, and so you would get billed in-network for the hospital and for the surgeon, but you'd get billed out of network for the anesthesiologist, which is a joke. So you'd get billed that, and then what would happen is the balance bill will be the difference between the high charge master price and what their insurance company paid, because your insurance company often will give you less of a benefit towards out of network coverage than they do in network coverage. In short, the charge master is a financial fiction. It's literally just financial wizardry that they use to benefit themselves, and it benefits the insurance company. And at the end of the day, it doesn't benefit the patient at all. They do it to help with negotiations and tax reporting. It is not an attempt to list a true market price. They have no incentive to give you a true market price when you call and get a quote. Literally none. No incentive for them to be honest. And my broader question is, because of this, if I am trying to be a conscientious healthcare consumer, because healthcare prices are so high, if I call a hospital or I call a surgical center and I ask them to give me a fair quote or a reasonable quote, or an accurate quote for that matter, on a healthcare procedure, how can I trust them to give me an accurate quote on a procedure such as a surgery or having a baby or something that has some complication, has some nuance and things can go wrong, when they cannot even give me an accurate quote on a tub of butter, essentially? Put all of your angst and all of your woes in the comments. I want to hear it.